The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
The Bible teaches us to respect and counsel with our elders. But sometimes elderly people get an affliction which makes it so that although they're still alive, their rich experience is cut off from us. Alzheimer's disease. This disease is the subject of this study. Stay by. I think you'll enjoy it.
Welcome to Help Yourself to Health with Dr. Agatha Thrash of Uchee Pines Institute. And now, here's your host, Dr. Thrash.
The affliction of Alzheimer's disease we see more and more frequently. Not only that, we're seeing it now in younger people than we used to. And perhaps one of the first things that makes a person understand that he or she is getting Alzheimer's, or their family may understand they're getting Alzheimer's, is the inability to bring up a word from the memory. They know the word well, but they simply can't remember it. In fact, if a person has as many as 2 3-second pauses in 1 minute of conversation, that could be the beginning of Alzheimer's disease. But since fatigue and distractions and many other things can cause a lapse in conversation, we must be careful in making this kind of disease. Since people who have a lot of other afflictions can be labeled with dementia, sometimes things that can be treated, then of course it's very important for us to investigate to determine whether the person really has Alzheimer's as a cause for their poor memory functioning. But once the disease is entertained, then the sad outcome is usually expected to result. Frequently in younger people, we're seeing this kind of disease. It often begins slowly and goes along to a fairly long time disease if it does begin slowly. Let me discuss for you a bit of the symptoms that people have with Alzheimer's disease so that you won't think you have a dreadful disease if you don't really have it. Forgetting where you put your keys and credit cards is normal, although annoying. But forgetting what you use them for is serious. This sort of memory lapse points to Alzheimer's disease, a progressive, degenerative disease of the brain that afflicts an estimated 4 million American adults. For most of us, the memory problems that come with age can be dealt with by using lists and other remedies of that nature. But people with Alzheimer's usually aren't helped by such tricks to jog the memory. We may forget a detail of an experience, but remember it with prompting. An Alzheimer's victim forgets the entire experience, often permanently. In the early stages of Alzheimer's, people may get lost in familiar surroundings, such as on the way to work. They may forget names of family members, repeatedly ask the same questions, or make the same phone call. Patients may also forget how to get dressed, how to pay bills, and perform other very routine functions. An accountant may forget how to add, as an example. Abstract thinking and language skills also degenerate. Patients often have poor judgment and find trouble in calling up a word. Not surprisingly, these people may suffer personality and mood changes as they become anxious about their symptoms, losing enthusiasm for life, and often becoming withdrawn. Still, there are more than 60 other disorders ranging from stroke and depression to vitamin deficiencies and adverse drug reactions, all of which cause similar symptoms. And unlike Alzheimer's, many of those problems are treatable. So it's vital that people who have trouble with memory symptoms get a complete examination. Now, once the diagnosis is made, then it can be a very serious and sobering thing to face those activities that will have to be curtailed as the individual faces a life with Alzheimer's disease. What can we expect in the way of survival? Well, a study was done on people with Alzheimer's disease, and this was discovered. Survival in this group was highly variable, ranging from less than 2 years to more than 16 years after symptoms appeared. The median time was just over 9 years. The more severe the symptoms at the time of the diagnosis, the shorter the patient's life from then until they died. By contrast, how long the patient had had the disease, that is, as judged by relatives and in a retrospective review of their symptoms, was not in itself particularly informative about the remaining life expectancy, but just how severe it is at the time the patient presents. Patients who were difficult to manage because of behavioral problems, and especially those who tended to wander and fall, had shorter than average survival times. That was presented in the Annals of Internal Medicine. Now, if these represent all the symptoms and the course that we can expect, then Alzheimer's might be easy to make a diagnosis. But let me read this. Strictly speaking, the diagnosis of Alzheimer's disease cannot be made without microscopic examination of brain tissue. That means actually taking a part of the brain tissue itself and putting it under the microscope. That, of course, would mean opening the skull, taking a bit of the tissue, and running it through the laboratory. Such tests would be expensive and also prohibitive because of the fact that most people don't want to give up even a small portion of the brain tissue. Although the symptoms and progression of Alzheimer's are fairly characteristic, especially as the disease advances, its hallmark is the so-called amyloid plaques and the neurofibril tangles, the minuscule gravestones that we find in the cells. And I'll show you how this kind of thing looks under the microscope. We have, let us say, 2 brain cells represented by these diagrams. Here is a brain cell looking somewhat like a turnip. Here is its nucleus, and nerve impulses travel in this direction. Down here at this point, the cell meets another brain cell going in the same direction. It also has roots somewhat like this to gather more information. And the way that these 2 cells talk with each other, so to speak, is because of chemicals that are produced in the first cell and affect the second cell, or affect little receptors on the second cell. But in Alzheimer's disease, instead of that, because of degeneration of a cell, the other cell, the next door neighbor, will begin to make neurofibrillary tangles, and so they begin to grow in this fashion. And in addition to that, deposited in these spaces will be some substance that we call amyloid, which is a type of protein that causes the interference, that causes a further interference of transmission of nerve impulses, as you see in this simple diagram. Now, while we can talk about it very simply, it is much more complex than that. What is it that causes the degeneration of brain cells? What is it that makes this amyloid substance be precipitated in the space between the 2 nerve cells? Another big question is, what kind of tests can we use that will enable us to make the diagnosis of Alzheimer's disease without going through expensive or invasive type of diagnostic procedures like opening the skull and taking a portion of the brain and looking at it under the microscope? I've mentioned one of those tests, and that is to check a person for as many as 2 3-second pauses in 1 minute. If they make a number of those, and it's continually done, searching for a word or for an idea or trying to remember what they've been talking about, this can be a sign of Alzheimer's. Another thing is that of drawing the face of a clock. Many people who have other kinds of memory lapses than that of Alzheimer's disease can draw a clock. But people with Alzheimer's disease may leave off all the numbers, or may put the numbers in the center, may have the hands of the clock pointing in the wrong direction, or hands are missing altogether, or in various other ways they forget what a clock is like and are unable to bring it up. This isn't 100%, of course, but it does help to differentiate between those who perhaps have a psychosis of some kind, or perhaps they are sick, or they may have some kind of distraction or a hormonal problem that makes them forget things. Another test that some have felt would cause Alzheimer's patients to be recognized is that of the sweetness test. Sometimes people with Alzheimer's disease begin to crave sweets. According to researchers at the University of California at Davis, an early symptom of Alzheimer's disease is an intense craving for sweets. Patients often eat sugar right out of the bowl or dip their fingers into the jam. And so we can see that this is another way that we can pinpoint this very difficult and sometimes almost impossible to diagnose disease until the patient is actually dead already. Every experience that we ever have in life is recorded in the brain. Every time we see a leaf wave in the breeze, this is recorded in the brain. Recording is not our biggest problem. It is recall that is our biggest problem. To get at the material, to have a retrieval system that will always accurately go to the place where we have the material stored and bring it up into the conscious memory. A healthy brain will do these kinds of tasks very easily. But persons who are preoccupied with their own thoughts rather than what is happening around them will often feel that they have a poor memory. But it isn't really a poor memory, it is simply the fact that they weren't paying attention when something came up. And memory can be very fallacious, as you know. The husband can say that it was Aunt Sue who played the violin, whereas the wife says, oh no indeed, it was not Aunt Sue, it was Aunt Jane. And they have a fallacious memory about that. And perhaps you can recall the famous newspaper article about a woman who was watching an afternoon television program, and it had been previously recorded and was televised for the first time. A man named Thompson. This man was then later accused by the lady who was watching television of being her rapist. He was arrested, and she came in and identified him as being the one who attacked her, and picked him out very easily from a group of men and also from pictures that she was shown. But the next day, the man remembered that he was on a live television show at the same time in another city. At the same time, the lady was viewing his television program in her home, and he was able to establish his alibi. What happened was that as the woman was watching him on television, she began to believe that he was the one who attacked her because his face was fastened in her mind. Memory can be quite fallacious in that way. Experts say that memory can be fine-tuned, however. Nearly everyone has the view that their memory is not as good as it used to be. I think I hear that so often. One man who was a professor did a study on this and found that most people believe that they are beginning the early stages of a degenerative disease. Unless you have trouble forming new memories, it isn't likely that you have Alzheimer's disease, where memory loss is progressive and devastating. Only 2% of people between 65 and 75 will develop Alzheimer's, according to scientific studies. The rates for younger people are far fewer. It's far more likely that the cause of your memory loss is stress, fatigue, illness, or disturbances from drugs, including alcohol and nicotine and coffee. Fatigue and stress can really do a number on your memory, even if you're a teenager, says researcher O'Brien. That's why students are advised not to study all night before a big test. Sleep deprivation will make it harder for them to retrieve information from the memory. We know that the way that we store information in the long-term memory is in REM sleep, or the rapid eye movement sleep, the kind of sleep that we have come to associate with dreaming. And so the individual must have gone to sleep for a long enough period of time to have that sort of mental mechanism of scanning the brain and fastening things to the memory that we see a sign of by the rapid eye movement that the person makes as the eyes seem to scan all of the stored information that we have in the brain. Since sleep that we get before midnight is worth roughly twice the value of sleep we get after midnight, our memory will be much better if we get plenty of sleep before midnight. As people age, they tend to notice an increase in the loss of short-term or episodic type of memory, the kind that remembers little episodes and can keep them in the short-term memory, such as where they parked the car or where they left the groceries when they brought them in. They may also be dismayed to find they've forgotten most of the lists they committed to memory as a child, such as the capitals of the 50 states or all the books of the Bible. But they needn't be worried about that. When we're 10 years old, we have a very limited fund of experience, but by the time we get to be 40, we have a very rich experience, and this tends to crowd out some of the things that we have put in our memories in our very early years and have treasured very much. And it distresses us that we have forgotten those things. But memories tend to be formed more easily when they're associated with an intense emotion, such as or even a pleasant kind of emotion, such as those that are involved in our schooling experience. Now, another thing that can help us in our skills at remembering is that of exercise. Exercise, which stimulates the brain to have more oxygen and more circulation, and also to clear out toxic substances. This kind of thing is very helpful for us in keeping a very healthy brain. Some have said that exercising, not just physical exercise, but also exercising our memory skills, that this also can be very helpful in preserving memory into advanced old age. I remember one time when when I said to someone to remember a certain number, which was only about 3 digits, and I gave her a pad and pencil to jot the number down. She said, "No, please don't do that." She was a woman of about 70. She said, "I am practicing keeping a sharp memory, and I want to remember all these numbers." And I think that that's very good advice. Here is something that came out in the Post. It says, the best place to keep your numbers, that's like your telephone credit card number or your Social Security number, the best possible place to keep your numbers is in your head. Wallets are misplaced, purses get snatched, and cards remain on tables after the diners have left. But you say there is no way you could remember all those numbers. But according to professors of psychology at the University of Los Angeles, we can remember much of the numbers that we think are just impossible to remember if we simply practice on doing that. The key to memory, these researchers say, is to have the numbers relate to something we already know. And if we can remember that the Social Security number is a higher number than certain other numbers that we need to remember, that can sometimes help us in our memory skills and keeping them always available for us. Now, what can we do as treatment for Alzheimer's disease? Well, the treatment for Alzheimer's disease is not well worked out. We don't have one thing like for appendicitis. We can go and remove it and appendicitis is gone. Or with diabetes, we can give insulin and the diabetes is gone. With Alzheimer's, it isn't that way at all. But one of the most important things that we have found is to get patients out of doors, just into nature. If they are able to do so, have them sit under the shade of a tree. If they're better able even, have them walk with you. And many times the physical health of a person with Alzheimer's disease may be quite good, and it may not be at all difficult for them to be out of doors quite a great deal. And that means the second thing that we try to treat Alzheimer's patients with, and that is exercise. Out of doors, even if they can't exercise, but if they're able to do so, then out of doors exercise is one of the most important things that we have discovered for individuals who have this kind of problem. Now, a garden can then be a very important adjunct to your treatment of Alzheimer's disease. Here is something that published in Your Health, but it could have been something that we wrote at Uchee Pines, since we publicize so much the fact of getting out in a garden. It says gardening can bring you more than vegetables, fruits, and flowers. How about physical fitness? And so far as the brain is concerned, we must remember that the brain is an organ of the body. The brain is not just something that is ethereal and somewhere out of body. It is, the mind is the function of an organ of the body, the brain. And if we're physically fit, the brain is more likely to be physically fit. It is good exercise because it involves the whole body in one way or other. Some years ago, we ran a test on people who were doing gardening, and we found that they exercised every muscle in the body during the time that they were doing their gardening. Physical therapists say it can reduce stress, improve circulation, and enhance flexibility. It is perfect for people who cannot jog or participate in strenuous activities, and for others who are physically capable but just don't like sweaty exercise and won't do it, like going to a spa or in some other way taking that kind of exercise. Harvard and UCLA studies of men found that some elderly men are at least as mentally able as the average young man, so far as their memory skills are concerned. And that's a very comforting thing for those of us as we get older. We wonder, what is the mind going to be like in the future? Is it, as was said some 15 or 20 years ago, that as people get older, they can't learn as well, their memories aren't so good? And what has been found by research is that it is not the fact that people cannot remember nor learn so well as they get older, but just that their interests are more constricted than they were many years ago. When a person is young, they often have a much broader interest in things than they do as they get older. Take as an example word salads. When we're young, we may enjoy puzzles with word salads, but as we get older, we have no interest in jumbling up words to string them together in a make-believe sentence. Furthermore, we have no interest in nonsense words, but younger people tend to have an interest in nonsense words. So in giving psychology tests or IQ tests to people who are older and comparing them with people who are younger, and on one page you give a word salad, and on the next page you require them to reproduce it, or as much as they can. Older people have so little interest in word salads that they don't do well on that kind of test. But if things that older people are interested in that make them perk up and take notice, those things, they have as much of an ability to remember them as they did when they were in their 30s and 40s. And I'm very glad for that comforting bit of information. We have found also that certain herbal remedies can be very helpful. Herbal remedies such as ginkgo. Ginkgo has a specific influence on opening up blood vessels in various parts of the body, especially in the brain. In this way, it is somewhat similar to the B vitamin niacin, which we have known for a long time is capable of opening up blood vessels. Zinc and zinc-high foods are also very important for people who are working on the memory. Those foods that are high in zinc are whole grains, legumes, popcorn, and pumpkin seeds. Those are some that are high in zinc. Some other things that we treat Alzheimer's patients with, the totally vegetarian diet. And of course it should be free from fats, because fats tend to, free from free fats, that's like margarine and mayonnaise, because fats tend to reduce the oxygen content of the brain and make it so that people are not so well able to have good mental functioning. And of course, sugars are also likely to reduce the oxygen content. Caffeinated beverages, even if they're decaffeinated, should be removed from the diet. Then foods that are high in folic acid, that would be especially dark green leafy vegetables, which also, by the way, have boron in them, which is known to be very helpful for people who have any kind of mental problem. Beans and all legumes and potatoes and whole wheat bread, these are all high in folic acid. And reflexes improve and the IQ goes up as people use these various things. Garlic assists in eliminating heavy metals, and if lead or mercury or aluminum might be a part of the problem causing Alzheimer's, then the use of a lot of garlic could be very helpful in this regard. Well, I hope that these simple things and the discussion of Alzheimer's disease has been helpful for you, and I hope you never have anyone, but if you do, may God bless you with these treatments.